This is scoliosis. All right. The medical term of scoliosis. The prefix is scoli/o, which means curved or bent, and the suffix osis is abnormal condition or disease. The definition and description. Scoliosis, by definition, is an abnormal lateral curvature of the spine. Scoliosis can be on any part of the spine. Scoliosis can be just in the thoracic spine, on the thoracic and lumbar spine, or strictly on the lumbar spine. Scoliosis is also known to be double curved, and the most common form of scoliosis is idiopathic adolescent scoliosis. The different types are congenital scoliosis. This form of scoliosis is derived from a misshapen vertebrae at birth. This would present itself at birth, but could be diagnosed later due to not seeing it right away. This could be a sign of other complications such as kidney and bladder problems. Idiopathic scoliosis, the most common form, comes from unknown reasons. Most patients are diagnosed around the age of 10 or just whenever the child reaches adolescence. This can inhibit growth and should be a concern. Neuromuscular scoliosis is this form of scoliosis involves weak muscles in the body and therefore the spine to not be straight or fall within the constraints of the muscles. Muscles are weak and unbalanced, making the spine develop a curve. Cerebral palsy is a good example of this. The muscles are weak and unbalanced, leading to an uneven spine. Some history. Scoliosis was defined as deformity in ancient Greece, with the earliest known documentation being from Hippocrates in 400 BC. The term scoliosis was defined as crooked and claimed by Galen in 200 AD. In scoliosis history, the advent of the Cobb angle is key, and as it became known as the orthopedic gold standard in the assessment of scoliosis. The Cobb angle method was invented in 1948 by Dr. John Cobb. Bracing for scoliosis was not invented until 1575 in France. Then in the 1950s through the 2000s, the Milwaukee and Boston braces have been added and approved upon. The most modern form of brace is the Scoli brace, made in 2012. Surgical response to scoliosis was first done in 1865 by Jules Rien-Guerin. He did this by cutting tendons and ligaments to straighten the spine, and with the invention of the X-ray in 1895, scoliosis could be examined closer for the first time. Paul Harrington performed the first legitimate surgery by inserting rods in the top and the bottoms of the curve in 1950. In the 80s, French surgeons Cottrell and Debussy worked off of Harrington and invented the double rod and pedicle screw, which is still used to this day. In the early 1920s, Katharina Schroth approached treatment differently by introducing an exercise method of treatment. Diagnosis. Scoliosis can be diagnosed by MRI, and MRI stands for magnetic resonance imaging. You can be scanned for scoliosis, taken from two angles from an X-ray tech. Then a doctor can examine the results and tell you the angle of Cobb, which refers to the angle at which your back is curved. Scoliosis can also be diagnosed through a CT scan. A computed tomography scan allows for someone to be placed inside the machine and has a very detailed output of bones, fat, and muscle, and allows for precise measurement of the Cobb angle. Causes. There are many causes to scoliosis, and here are a quick few. Cerebral palsy, muscular dystrophy, birth defects, infections or injury to the spine, tumors, genetic disorders, one leg being longer than the other, muscle spasms, inflammation, family history, being a twin, and more often than not, girls will develop scoliosis more than boys. Some symptoms: difference in shoulder height, head not centered with the body, differing hip heights or shoulder blade positions, difference in arm sway when walking or in height when standing still, sides of the back are different heights when leaning forward, asymmetric ribs seen on the ventral or dorsal side of the body, and overall back pain. And levels of severity. Scoliosis is defined in the Cobb angle as mentioned before, and they go in increments of mild to very severe. Mild, Cobb angle is measured between 10 and 25 degrees. A moderate Cobb angle, or a moderate scoliosis, would be between 25 and 40 degrees for the Cobb angle. Severe would be defined in 40 and 80 degrees. And very severe is any Cobb angle above 80 degrees. Lordosis, kyphosis, and flatback are similar to scoliosis as they curve the spine. Lordosis is an abnormal increase in the forward curvature of the lumbar spine. It's seen in the middle to the right. And then kyphosis is an abnormal increase on the outward curvature of the thoracic spine. And flatback is a loss of curvature in the lower spine. And population and gender. According to Bisset and Rousseau of Nova Science, there are a lot more girls than boys with scoliosis. They took a population of 4,100 students in the area. Their ages range from 10 to 16 with an average age of 12. The participants, the students, were screened by the two doctors above, and there was a radiograph made for each student. From the 4,100 students, there was 224 that had a form of scoliosis, and the incident rate was 5.4%. The female to male ratio of people who had, or of the students who had scoliosis, was 7.6 to 1. Age. With respect to age at onset, the incidence of adolescents' idiopathic scoliosis was 2.7%. Juvenile 3 was 1.5%, Juvenile 2 at 0.6%, Juvenile 1 at 0.4%, and infantile at 0.07%. And there seems to be a trend that there are more cases of scoliosis as you age, as in the graph. Some other statistics relating to Bisset and Rousseau of Nova Science is the amount of students that had a curvature in a certain part of their back. The graph shows the difference in which part of the spine is curved and between genders. Looks like genders didn't matter much to which curve location was more common. Lumbar curve is the most common curve. The next most common would be thoracic, then to a double major, then lastly to a thoracolumbar. Another set of graphs shows the differing curves and which way they curve. Lumbar curves tend to bend left, thoracic curves tend to bend right, and thoracolumbar curves tend to bend left. The last graph shows the Cobb angle that is most common is betwixt 10 degrees and 20. Genetics. Although there are many advances in genetics in the science world, there are still no tests to determine similarity between genetics and scoliosis. Nova Science states that there are some tests for genetic complex disease, which are the most common in the general population. This would include diabetes, cardiovascular disease, and idiopathic scoliosis. Through genetics, there is genetic counseling which determines a patient's information through a familial trait, characteristics of a disease, modes of transmission, and other ways. Analyzing these can give you the results on how much genetics can contribute to a disease or if it is totally random. According to Bisset and Rousseau, that there is an increased risk of having idiopathic scoliosis if someone in your family has had it before. Therefore, the disease is hereditary, somewhat. There is also a study that suggests that twins are more likely to develop scoliosis going into adolescence. Therapy and treatment. You might have heard of chiropractic practices helping out or damaging scoliosis patients. This is true on both ends. Most chiropractors are better clinicians than diagnosticians. They can help a patient but might not be great at telling what back problem they could be having. Effective diagnoses can lead to a great therapy and lead to a better quality of life. In most cases, there is not a way to fully heal scoliosis, only to help it to be better. The only way to get it back to normal would be through brace or pins. Scoliosis can often benefit from exercise. The Schroth method from our history section is a great approach. The Schroth method involves tailored exercises for each individual's different curvature of the spine, and this can strengthen and stretch the spine and help for management of scoliosis. Bracing is only needed when you are at a severe stage or above. This can help a kid shape their spine into somewhat normal of a curve, but this will not help children have congenitally abnormal vertebrae. Surgery is the last form of treatment, and this can be a spinal fusion, which would have the curved vertebrae fused together so they can heal into one solid bone, but the patient would not be able to grow. Hemivertebra removal is a single partial vertebrae is removed and can correct through another 2 to 3 vertebrae being fused. Growing rods are placed every 6 to 8 months depending on a child. These will hopefully let the child grow while mostly fixing the curvature of the spine. When the kid is fully grown, they would be removed and no surgery would continue. Recent studies. A recent study on early onset scoliosis was done in August of 2023. EOS entails children under the age of 10 developing deformities in the spine and chest wall. The study reaches to find new ways to better help children with EOS by diagnosis and assessment, surgical options, and basic innovation. The study covers somewhat of implants in the spine, promoting growth and overall health. They define EOS as any scoliosis, which means any Cobb angle over 10 degrees. They tested differing methods of surgery on different patients. All patients had one type of scoliosis, either neuromuscular or idiopathic. The researchers can conclude that surgeries are successful and the management of scoliosis continues to evolve. There are some diseases like spinal muscular atrophy that you don't see as often because of these and basic science treatments. The researchers also state that the spinal surgeons work to optimize treatment in the EOS patient population. There are also studies through the Mayo Clinic. The Mayo Clinic is conducting studies through volunteer participants. The study is going to try to explore the relationship between skeletal muscle and physical activity in scoliosis patients. Since this is an ongoing study, there is no other information. And my experience. I've had scoliosis since I was 10. Being a twin increased my chance of having scoliosis. I was diagnosed through an MRI. At my first diagnosis, I had a 12-degree tilt, so a mild tilt. I had many instances of overall back pain, or when I would bend over, you can very much see that my back was different heights. I mostly had between 12 and 15 Cobb angle from the time I was 10 to 17. I was doing sports and never had many problems with my back other than the pain and just the odd look of it. I still grew to 6'1" and had a normal growth, and according to my doctor at 19, I'm still slightly growing, and my slight scoliosis has not stopped that. My angle went from a 10 or 14 degree from my last checkup when I was 17 to a 5-degree tilt when I was 19. This was when I went full-time into baseball and working out, and I can still say that my back feels a lot of pain, but I've mostly grown out of scoliosis just with a slight tilt. I can also attest to working out and exercise helping a lot of my back problems. And the references. All right. Thank you for watching.